So I think we can now start with my lecture. I just want to tell to other people who don't know me, yeah, but a certain amount of people know me, who I am, yeah. I'm currently working in Sweden, yeah, but I'm from Latvia. And one more thing, I have master degree in optometry and visual sciences as well. I am optometrist as well. And I have been working, or I was working as optometrist for 5-6 years, approximately 20 years ago. Yeah. So I have very clear idea what optometrists are doing and how much they have to know about ophthalmology. Yeah. So let's start again about the same thing, but now I will speak about again from medical point of view. Maybe this topic will be a little bit more complicated, yeah, but I am presenting for my students from Faculty of Optometry in Latvia, or approximately on this level, yeah. So I hope colleagues from Estonia and Lithuania will accept this level, but I think we have to learn more and more, not just to be on the medium level, yeah. So I will show you immediately one very interesting slide. Yeah. I presume that you have seen something somewhere because it's quite famous slide. What you have to pay attention to. You again look on the left side. It's aqueous deficient. Yeah, dry eye, and look on the right side. It will be evaporative dry eye. Yeah, the main difference is aqueous deficient. It is mostly connected with production of fluid, yeah, or this tear production. Yeah, for this reason, if you look this left side, you again can see my favorite Sjogren syndrome, which I'm working with. Yeah, and you can see Sjogren syndrome could be primary and secondary. Yeah, so primary, it is real Sjogren syndrome. I tell you, autoimmune disorder, which can develop in any age. I would say around 20 years old person eventually can have already a Sjogren syndrome, but mostly around 30 years old and later. Yeah, and definitely person will have decreased Schirmer test and certain level of staining of conjunctiva and cornea with rose bengal. Yeah, I tell you, yeah, I'm mostly using rose bengal. So secondary Sjogren syndrome, it is again autoimmune disease, something like rheumatoid arthritis or lupus erythematosus or something similar. Yeah, by look quite similar. Yeah, maybe Sjogren syndrome is a little bit more damage and more dry eye. Yeah, the secondary Sjogren maybe slightly less problem. But again, I wouldn't recommend to all this group of people offer contact lenses, especially on the regular basis. Yeah. So again, next is non-Sjogren dry eye. But again, it's still connected with production of fluid or tear. Yeah. So it will be a problem with this medium level of tear film. And evaporative, it's mostly what you are dealing with. Yeah. It's mostly eye conditions. Yeah. Or connected to contact lens user. Yeah. Or connection to some ocular surface diseases like conjunctivitis, keratoconjunctivitis, and so on. Yeah, but I have done a little bit comments about this table that you keep in mind that here it's Sjogren and similar diseases. Yeah, and some other diseases connected with lacrimal production. Yeah, and this is right side is evaporative. It's mostly I tell you superficial eye conditions. Yeah. So, I can show this this little bit, this first slide, but it's actually the same. Just keep in mind that if you read something about dry eyes, that it could be somebody can use this terminology like aqueous tear-deficient dry eye, ADDE, and evaporative dry eye, EDE. Yeah, I hope that somebody heard about this. Yeah, and I tell you, it's again that ADDE connected to failure of lacrimal secretion. Yeah, but just keep in mind this lacrimal secretion is not only with this lacrimal gland, but there are some small glands on the conjunctiva which secrete or produce lacrimal fluid. Yeah, and EDE mostly connected to some problems in eye surface. Yeah. So, and let's go to this again, a little bit again, repetition of the Sjogren syndrome. You know what? It's like exocrinopathy. Yeah. It's actually damage to lacrimal gland. Number one, and I tell you, is this lacrimal gland mostly, which is sitting here, yeah, in this area of orbita. Second, you see, it's also damage to salivary glands. A salivary glands, it is in our saliva, yeah, in our mouth. For this reason, usually both complaints are present. Person complain of dry eyes, with the special symptoms, yeah, and of course, most of them are saying that it's also dry mouth. I would say most of them, 90% is coming already with this complaint of dry mouth, yeah. And I tell you, it's autoimmune disease, yeah. For this reason, other organs in the body could be also affected, yeah. And it is develops special autoimmune process with release of inflammatory cytokines, yeah, and circulating antibodies. Yeah, it's typical feature of autoimmune disease. Yeah, if you ask me what to do, I would be very careful to put with patients who have this primary Sjogren syndrome, and just keep in mind that it's forever. Yeah, it's for diagnosis, chronic diagnosis, yeah, for whole life. Yeah, but again, it's depend of person to person. Yeah. Maybe offer him very high permeability contact lenses, high quality, never sleep, never. Yeah, because if person start to sleep with such syndrome, it definitely will be corneal sore one day after tomorrow. Yeah, but try to avoid this such people contact lenses. Yeah, if you ask me next question, what about refractive surgery? No, never. Years ago, I was working a little bit with Felix Lukin, yeah, and we for 3 years, and I have idea what happened with patients when we had missed some autoimmune disease. Yeah, this means a person will undergo refractive surgery with laser and have underlying autoimmune condition. There is two options, or he will have problems immediately with healing of the cornea, or he will have problems later on one day, and it will be still problem. Yeah. If you ask me what we will do, what we can do for person who want to undergo refractive surgery, we are trying to collect very, very proper anamnesis. Yeah. Of course, we can't send everybody to do special antibodies, yeah, but evaluation is very important, yeah. But unfortunately, all these autoimmune diseases, yeah, actually like contraindication for contact lenses and also for refractive surgery. I would say absolute indication for surgery, but relative contraindication for contact lenses. In any situation, contact lenses is better for such kind of people, yeah, and refractive